Hello, and welcome to our Magnet Conference 2025 recap with Nursing Consulting Partners. My name is Renae Kendall. I am one of the consultants with Nursing Consulting Partners. I have a master's in nursing and am Nurse Executive Board certified. So a little bit about our conference overview. The Magnet and Pathway 2025 conference, the overall theme was Power of Nurses. There were around 13,000 nurses in attendance. There were over 200 educational sessions, along with 170 posters available for viewing. Many of those posters are still available for viewing online. There were 451 speakers and an amazing exhibit hall. The exhibit hall, I feel every year just keeps getting bigger and bigger with more and more vendors to look at. We, of course, had an exhibit booth there. Hopefully everybody got a chance to stop by and visit us. If not, you can always reach out to us online and we'll gladly walk you through all of our services that we have available. And of course, tons and tons of networking opportunities. That is one of my favorite things with the conference, is the ability to network with your peers. You can network with, if you're an MPD, another MPD. If you're a CNO, with your CNO peer group. They have always the CNO luncheon, and then they have the MPD sessions that everybody can meet with there. But you're standing in line and you get a chance to talk to people. You go to your sessions, you get a chance to talk with people. But that networking is where you make everything happen. The conference review highlights. So a little bit about the conference. There were 52 pathway designated sites and 152 magnet sites that were honored on stage. The plethora of keynote speakers and panel presentations. There were breakthroughs in innovation and technology that were showcased. There were networking and collaborative workshops. While the sessions and the actual conference started on Wednesday, so many things were happening on Sunday, Monday, and Tuesday pre-conference that hopefully some of you had the opportunity to take advantage of. There was research findings, impactful studies that were presented. There was a whole research pre-conference event, but all of the research that was presented in the posters and the presentations. And there was so much strategy discussions on the future trends and planning that were available for everybody to take in. So some of the magnet stats that were presented at the conference, some of these came from the MPD session that was there, and some of them just were throughout the rest of the conference. There were 642 designated organizations. Now these was nationally and internationally. 48 of those are PEDS only, so pediatric only facility, not those that have PEDS inside the facility as well, but pediatric only. 3 ambulatory only, and 1 long-term acute care, so an LTAC unit. 54 sites have magnet with distinction, so that number is slowly growing, and over 620 magnet program directors. Here are some more magnet stats. So for those that are one-time designated, there are 160 sites, so that makes up about 25% of the overall total. Those that are 2-time is 150, 23%. Those that are 3-time magnet designated is around 98%. 4-time is 118, 5-time is 86, and those who are 6-time designated, there are about 25 of those sites. And those that are 7-time designated, there are 5 7-time designated organizations, which make up less than 1%. I think that is an amazing feat, and congratulations and kudos to those sites. International international presence. As we know, Magnet is not just a United States presence. There is a growing international presence. There are 22 facilities in 12 international countries. And the countries are all broken down here. We have 9 in Saudi Arabia, 1 in Lebanon, 1 in United Arab Emirates, 1 in Spain, 2 in Australia, 1 in Brazil, 2 in Finland, 1 in Japan, 1 in Mexico, 1 in Canada, 1 in Colombia, and 1 in Jordan. Some other takeaways from the Magnet program session. DAISY has introduced a new award for MPDs. Many of the MPDs are often the ones who the DAISY organization within the organization falls on. A lot of MPDs are the ones organizing the DAISY award for all of the frontline nurses and the leadership within the organization, but there was not an actual award that the MPD would be recognized for. DAISY has taken that upon themselves, and they have actually created an MPD award for the MPDs. Nominations can start in February of 2026, and the MPDs will be recognized at next year's conference. There will be 3 MPDs recognized for this award. Of course, you as an MPD cannot nominate yourself, but your peers can nominate you, your leadership team can nominate you, and 3 MPDs will be recognized at the October 2026 conference. So nominations open in February for the new DAISY MPD Award. So thank you to our DAISY collabs. There was, again, talk about the Magnet Marketing Toolkit, which has new logos for Magnet and Magnet with Distinction. They are there on screen. These were introduced a little bit ago, but I don't know that everybody was aware of them or had seen them yet. So there was some talk about them. So if you have not seen them yet and want to take advantage of looking at that, go to the Magnet Learning community and see the new toolkit. They also have some for those of you who are on the journey, so be sure you're looking at the correct one if you're either on the journey or if you already have Magnet and or Magnet with Distinction, that you're pulling up the correct toolkit. We also discussed some of the DDCT changes. So the DDCT, the timeline of when your DDCT is due and what is required for the DDCT hasn't really changed so much. They're still collecting the same amount of data and the same kind of data, so that so much has not changed, but there are some good changes within it. What has changed within it is there is now a direct upload feature from the Excel worksheet. So out in the Magnet Learning community, you can go to the DDCT section under Resources, and there is a Excel worksheet for the DDCT that you can use to fill in as you're working on it. So you look at your unit, you figure out your stats for your unit, what your turnover is, and all of that stuff. And instead of going to directly enter that into your DDCT, you can now upload that to your DDCT, and it will help you save a lot of time. You no longer have to double enter all that. So before we had to enter that into the Excel worksheet, and then we had to go into the DDCT and manually double enter it. Now there is an upload feature from that worksheet directly into the DDCT. The DDCT now resides in ORS, and so it's a lot easier to be located. There is a change with the certification tracking. So prior to these changes, September 29th, on each unit you used to have to track on, let's just take medical, you used to have to track how many FTEs on medical had each certification. So let's say you did the CMSRN, you needed to know how many FTEs had that, and you also need to know how many had the Med-Surg-BC certification, and however many had any other certifications on there. You no longer have to do that. You now just need to know on your medical unit how many have any certification that's approved by Magnet or is an approved certification, and collectively enter that total. So that will save time delineating out which certification all of your nurses collectively on a unit have. Again, they still have to be approved by Magnet through those 4 certifying bodies, but you no longer have to spell out the differences on that. The other thing is ORS data will now cross to the DDCT. So like all of your organizational information that you have to enter into the DDCT, when that's entered into ORS when you do your application, that now crosses to the DDCT. So that was discussed during the Magnet overview session. The other thing that we discussed was exemplars. So non-EO exemplars, so not the Big 5 data and those kinds of things, but actually some of the narrative exemplars. What classifies as an exemplar? So some people wanted some examples of what an exemplar is, and so they came up and gave the definition of a concept or a practice that is worthy of imitation. So programs that go into the community, interprofessional teams providing care, practice that's applied in a unique way, exceptional outcomes proven by data, or anything that's worthy of presentation or publication. So we just kind of had some discussions on exemplars, and then we kind of gave our feedback that it would be nice to see some examples of some exemplars so that organizations could kind of see what those look like, some other than the EOs. People kind of understood the EOs, but they wanted to see some non-EO exemplars. Some of the overall themes from the conference that kind of came to light were well-being. Well-being was a theme throughout the entire conference. Well-being and nurse burnout. There was several areas that we heard about the ANCC Wellbeing Excellence Credentialing Program. This is a program, if you've not looked into it yet, you might want to take some time to do so. They had 3 different levels of credentialing that you can get. There was the gold, silver, and bronze. It was discussed a lot in the Pathways program. Pathways focuses a lot on nurse well-being, so if you want to take a look into that, during the Pathways sessions, they showed which organizations have successfully gone through the credentialing program, and it is not just for hospitals. Simpler was one of the ones that has actually gone through it already, just to showcase that it's not just for organizations, hospital organizations. So take a look into that if that fits your needs there. But well-being was a theme throughout the entire conference, as well as the importance of multidisciplinary collaboration to achieve well-being, relying on your other teammates, relying on your other resources in the other professions, pulling in pastoral care, pulling in social work, pulling in your well-being officers if you have those, relying on those interprofessional connections. Taking time to stretch, engage your other team members, engage in the offerings that your organization has in place, ensuring you're getting your lunch breaks, doing mental check-ins, and engaging in the professional development opportunities and the impact that that can have on your actual well-being. The other thing that was aiding in well-being was engagement in gamification, and just those mental breaks from the chaos of the unit, and just a 5-minute break on a gamification and how that can shift your brain a little bit. I know we at Nursing Consulting Partners are working on a gamification. We actually have it to where it can help with site visit readiness, and just how that shift in the brain for just a little bit of time can actually help with well-being in the long term. The other big theme was technology. As I'm sure we are all very well aware of technology, theming throughout the country and throughout healthcare. AI was everywhere we turned. It, of course, can enhance the diagnostic accuracy and the treatment of your patients. It's going to optimize your clinical workflow and your decision making. Everywhere we turned, there was AI. They even had an AI chat robot to assist us through the conference. There really was no way around getting through AI. So AI is the next wave of healthcare, and how can it assist nurses at the bedside to make their day-to-day easier, quicker, better? How can it help them through charting? What avenues are there? So many vendors had some AI stuff going on. There are surveys out of where nurses feel on AI, how nurses feel on AI. Are they ready to embrace it? Are they afraid of it, or not so much afraid of it, but what are their concerns with it? So that, of course, was a big theme. The other one is virtual care. It expands healthcare access and patient convenience, and it enables remote monitoring and timely interventions. But again, what's nurses' take on it? What are the outcomes showing on it? The vendors were there to demonstrate that and to see where nurses are on that, and what organizations have proceeded with that, and where other organizations are with that. What's the bandwidth for nursing on that? But that was another big theme throughout the conference. The integration of AI and virtual care, it supports sustainable healthcare solutions. It takes innovation. It takes innovation and collaboration across the teams. Some of the other themes that came through, multiple sessions, multiple posters, vendors, was professional governance, shifting from that shared governance model to the professional governance model, and what the difference between those two are. We here at nursing consulting partners work with organizations on shared governance, professional governance, so feel free to reach out to us. We'll gladly walk you through all of that. Another one was workplace violence. You know, it's no surprise nursing has concerns with workplace violence, but that was a theme throughout several of the sessions and posters. Night shift engagement. There were a lot of sessions and posters on night shift engagement, how to get your night shift engaged, keeping retention recruitment up for the night shift, and how to get those nurses, which are oftentimes your newer nurses, to want to stay engaged and to keep their engagement to where they're not turning over so quickly. Overall recruitment and retention, and then research. The research symposium was on Tuesday, I believe it was Monday or Tuesday, but research overall and how to get new nurses engaged in research, how to get frontline nurses engaged in research, and how to make everybody understand research and how to make people interested in research, especially those frontline nurses who are not savvy with research. There was also a session on Magnet 3.0, the future of nursing research. So there was a research being completed on the entire Magnet model and the future of Magnet. It was done over an 18-month period, and we have been patiently waiting for the results of this research study. They presented the research study. For those of you who went to conference, all of the slides for this are available within the handouts portion of the slides. But they had a special session on Thursday morning to release the results of the research, and so here is kind of a summary of that. So they did it in 3 phases. They did the research in 3 phases. They did phase 1, which was a lit review, and they had a question where they looked at the outcomes of Magnet. So they reviewed 131 articles total and looked at the outcomes of Magnet organizations compared to non-Magnet organizations, and they said, what were the outcomes? So they looked at patient, nurse, organizational, and economic outcomes. All 4 of those areas demonstrated greater than 50% positive outcomes in Magnet organizations compared to non-Magnet organizations. In phase 2, phase 1, lit review question 2, they looked at 123 articles, and they looked at the Magnet model components for relevance. And of the 123 articles, they very strongly supported transformational leadership and structural empowerment. There was strong support for new knowledge. However, there was weaker support for exemplary professional practice and empirical outcomes. So that exemplary professional practice, they said that basically it pointed to areas like the professional practice model. And they didn't really go into a whole lot on the empirical outcomes because they didn't delineate it down to which empirical outcomes they were pointing to. They didn't, spell out, was it Happy's, Falls, that kind of detail of the data, because I think they actually used the words like empirical outcomes, so it was kind of hard to figure out what they were looking for in that area. So phase 2 of the research that they did was on e-surveys. They sent out e-surveys to people, and they got over 2,500 responses back. These were numerous questions on the perception of Magnet from clinical nurses, non-clinical nurses, and international nurses. Leaders favored Magnet more than frontline. Overall, Magnet equaled excellence on what they received back. There were some concerns noted about costs and the application process. Obviously, there were a lot more feedback on that, a lot more questions answered, but conceptually, that was the overall take of those. Phase 3 was an interview with 27 people. 200 over out of greater than 2,000 were willing to be interviewed, but they narrowed it down to 27. Out of the interview portion of it, the takeaway was they want to retain the transformational leadership, or retain leadership. retain the voice of the nurse, and career development section. They want to focus more on patient outcomes and retention and recruitment. Their concerns are with the current NK standard. While they want to keep new knowledge and evidence-based practice, they have concerns with the approach to it, especially for organizations that are smaller or perhaps ambulatory or peds only, or those kinds, or those that do not have this huge academic center to support the research structure. There's also concerns with the application process and the especially for the areas of international applicants and the translation process needed for all of that, and the cultural differences. So the next steps with the research is there is a group that will be analyzing the findings. The Magnet Program Office will review all of the data. They will make a determination then on what will need revision in the next manual. There has not been a new date set for the next manual. The researchers hinted at possibly doing another phase for the research, but nothing has been set in stone. So what are your next steps? So that's kind of an overview of what the conference had. It was a great time. Of course, there was the welcome party. They had the aquarium there. They had the Coca-Cola. We had all these fun times. There was great restaurants. There was all of that fun stuff to do. You got to explore the city. You got to do the amazing fun stuff and all of that. But what is your next step on everything that you learned? Recap the exciting takeaways from the conference. What is something that you can take away from the conference and apply it to your organization? Share with your peers. Take what you've learned and take it back home. Take it to your peers. How can you implement something back at home? And then determine what are your next steps for your magnet journey. Are you ready for mapping? Are you ready for a mock site visit? Are you ready just to do a needs assessment, a gap analysis? And then once you determine that, reach out to us at Nursing Consulting Partners for assistance. We would gladly go over what that looks like for you. We'll gladly help you and walk you through the journey and see where we can be of assistance for you. Please reach out. We'd love to be of assistance. Thank you.